Okay.
Okay. Hard time or hospital treatment. When it comes with mentally ill people and the criminal justice system, it's really a decision, a clinical one, whether they go to a jail or a hospital. It's mainly the gatekeepers' decisions like police, prosecutors, or judges. According to the Treatment Advocacy Center, 20% of inmates are mentally ill. That's 356,000. That's someone's mother, father, or a good or a additive to our community. Families every day are going on without people that they love that they're missing from their families. Like for myself, my grandmother was in prison for 10 years due to mental illness. So the issue is that prisons have become the new warehouses for the mentally ill, and the crimes they commit are rarely aggressive or a violent act. It just seems to be there's nowhere else to place them. They are using it as a holding cell. So there are some solutions though, starting with ensuring quality mental health facilities. That's a good step in reducing the incarceration rates of people with psychiatric disabilities. It would break the cycle of the revolving door of constant return rate of inmates that have mental illnesses who don't get treated, and the problem never gets solved. According to the American Hospital Association, there are only 401 psychiatric hospitals. There are 1,719 state prisons and 102 federal, and then it continues into juvenile. According to the Slate report by Danielia Lithwick in 2014, there were 268,000 severely mentally ill inmates in prison and only 35,000 severely mentally ill in psychiatric hospitals. Dr. Raina Kapoor, a psychiatrist from Yale University, ran an outpatient psychiatric program that dealt with those involved with the criminal justice system. She found a common dynamic that there's not enough psychiatric beds. So when the police were bringing people in for help, they quickly saw that they were being turned away and they would be back on the streets within hours with no medication or no follow-up plan because the facility didn't have enough beds. And so the officers are left time after time when they start realizing their help isn't being placed anywhere. They turn to the jail system because that's the only place to hold these people. In Houston, Texas is one of the cities that are making moves for mental illness. They have a bunch of facilities that include inpatient and outpatient, so that if you did need to stay in an inpatient, that it was also possible, but there's also a solution for outpatient if you wanted to go home to your family and get the help you needed. Houston Behavioral Health Care Hospital has both those types. It offers support groups, therapy, a positive setting, a stable follow-up plan, and most importantly, a trained staff for these people, which is the most important because it's people that have committed their careers towards bettering and stabilizing these people for our communities and to help better the United States instead of sitting behind bars, because jails have admitted that 83% of their correctional officers have no training for mental illness or any training in supporting it. This would bring the numbers down if we could start replacing prisons with mental health facilities. This would also give these people a chance to get back to their families or actually have a chance for rehabilitation. Another solution is remove mandatory sentence guidelines, because over time our healthcare system has neglected many people who have trivial offenses, but time after time nothing gets fixed, so it turns into these huge sentences. An example Dr. Kapoor spoke about in the New England Journal of Medicine was a circumstance where a paranoid man was in a convenience store and the manager asked him to leave, and he went and hid behind a dumpster. So the manager called the police and they couldn't get him out from behind the dumpster, and they finally arrested him, and he was charged with criminal trespassing and resisting arrest, which is a minimum 2 years in prison charge. So this man was sent to prison for 2 years, and while he was there, they prescribed him an antipsychotic medicine. He had not been treated or sat down and looked at. The man was paranoid about the medicine, the safety of it, so he refused to take it. He refused to ever come out of his cell because he was confused as to what was happening. Nothing's really explained. So the officers proceeded to forcefully take him out of his cell since he would refuse to. And while they did that, he started to fight back with them. And after that, they put him in isolation. And for a felony charge of assaulting an officer, his sentence went up to 15 years. So all because of hiding behind a dumpster and miscommunications of how the brain of a mentally ill person works, and lack of understanding the situation, this man got 15 years of basically just dwindling away like a flower would need sunlight and water. These people are like that, like every person is. You can't just push them in the dark and expect, with no care, that anything would happen except them dwindle away. So that's where judges and mental health courts can come into place and look at each circumstance separately and be able to look at a person and put away this charge is this many years, that charge is this many, and look at a person as what's happening in their mind and understanding them more deeply. Because as taxpayers, the money that goes towards the prison system is $80 billion a year, and there's really no benefit coming out of it. We practically just have more revolving doors of returning inmates, which is why we need to separate criminals from the mentally ill and put them in separate courts, because it's just not the same thing. So the Chicago Mental Health Court in Cook County, the sheriff says they have processed 300 about a year, which helps send them to facilities or helps them get the right circumstances that they need to better themselves instead of just throwing them behind bars and letting them worsen. So the mental health court path is also a good one to take. There's also crisis intervention teams, which is while mental health budgets have been slashed, it's better to also take a front door approach before it even hits the prisons and jails. A crisis intervention team model is designed to improve officers' ability to safely intervene and link individuals to mental health services and divert away from the criminal justice system. According to the model, volunteer officers would get around 40 hours of mental health training from mental health clinicians, doctors. They would meet with people with mental illness, family advocates, and police trainers. Training would include information on signs and symptoms of mental health and the mental health treatment, co-occurring diseases like excited, delirium, adult trauma, paranoia, things, or de-escalation techniques where things wouldn't get so elevated and the prison and jail sentences and all that wouldn't have to be taken. They could kind of just handle the situation as is. So there's been crisis intervention teams in Connecticut that respond to mental health crises, and also healthcare diversion programs in Miami and Dade County that have helped countless people stay out of the prison system and actually get rehabilitated and get back into the community and offer something. But with mental illness being such a big problem in this country, police officers daily, 10% daily, face mental illness in the public. So being trained is just a big part of what we should be doing right now as a country. But all in all, this is a big issue and everyone's involved. It would take a lot of footwork to completely tackle it, but with the facilities, more facilities being made, maybe a legislation change in the courts or the crisis intervention teams, that's a good step, and that would definitely help a bunch of families. It would help our tax money, and it would help it's a humanity issue where it's not right to hold all those people wrongfully somewhere when they're not criminals, they just need help that we know the research and study for and kind of don't put the work towards, even though we've done the work.